If you see this on the wrist of your hand, stop what you are doing immediately and call the doctor. The reason is scary. Wrist injuries are very common as we use our hands almost all the time, but some of them might be a sign of another bigger problem. Wrist injuries can occur as a result of inflammation, a broken bone, infections, abnormal growths and cysts, as well as tumors. Not every injury is that serious, but you need to learn to pay attention to the signs and know when to visit a doctor. A swollen wrist may be caused by arthritis, bursitis, tendinitis, as well as sprains, strains and bone fractures. The reason can also be a benign or malignant growth, which is why we recommend visiting a doctor if the injury doesn't heal. Here are the main causes of wrist injuries. 1. Tenosynovitis is the inflammation of the fluid-filled sheath, synovium, that surrounds a tendon. The inflammation is usually caused by a microtrauma or stress, and mostly affects people with physical jobs. The abductor muscle and the short extensor in the thumb are usually affected by the inflammation, which can thicken the ligament and damage the sheath, synovium. 2. De Quervain syndrome. This unusual disease causes soreness and swelling in the wrist, besides also causing cysts and nodules. The affected part of the wrist is the extensor ligament of the thumb, which is responsible for moving the thumbs up and outwards. The syndrome will thicken your ligament up to twice its size and make any wrist movement extremely painful. 3. Nodular tenosynovitis. This problem is caused by tumors in the hand. They usually occur in the thumb, index and medium finger, but can also be found in the wrist, hip, ankles, knees, spine and shoulders. These tumors are commonly painless, as only 21% of the patients have reported pain. 4. Ganglions. Enlarged ganglions in the wrists are lumps related to degeneration of a synovial cyst or some other connective tissue or fibrous structure next to the joint, usually a ligament or tendon. This may be connected to a past trauma, with 50–70% of the lumps on the wrists being gangliomas. They usually grow up to 2.5 centimeters in size. 5. Lipomas. Lipomas are benign tumors in the wrist that may also appear on the palm. They can be very debilitating and might render you unable to extend your fingers. Lipomas are always accompanied by pain and an increased sensitivity. The treatment for wrist injuries depends on the severity and the cause of the problem. If the injury is annoying and painful, it can be treated with painkillers. However, if it causes bigger problems, it may require a surgery. This is why it's important to recognize the problem on time and consult with a doctor for the appropriate therapy.